Welcome to the deep dive. Today we're getting into something specific. Transient idiopathic osteoporosis, TIO.
That's right.
You've sent us your notes on this, and basically our job is to pull out the key stuff you need for revision. Make this rare condition make sense quickly.
Okay, yeah, let's do it. So TIO, what is it? It's a rare condition. Key thing is sudden bone pain and, well, temporary osteoporosis.
Temporary, okay. And where does it usually show up?
Typically the weight-bearing joints, so think hip, knee, sometimes the ankle.
Right.
And maybe the most important point, it's self-limiting. It gets better on its own.
Self-limiting, got it. Good one to flag. Now, causes, etiology. The notes say it's a bit of a mystery.
Yeah, that's the idiopathic part. The exact cause isn't totally clear, but the leading theories point towards hormonal factors, maybe vascular issues.
Vascular, like blood supply.
Exactly.
Yeah.
The idea is there's a sort of temporary glitch in the blood supply to the bone. Transient ischemia, we call it.
Okay.
And a reduced blood flow, even temporarily, seems to lead to this bone loss, this osteoporosis.
Makes sense. And the pregnancy link. You mentioned hormones.
Right. In pregnancy, you've got these massive shifts in hormones, estrogen, progesterone.
Mm-hmm.
And it's thought these shifts might, somehow trigger TIO in some women. Maybe it puts extra stress on the vascular system or bone metabolism.
Interesting. So who tends to get this? The notes mention middle-aged men and pregnant women.
That's sort of the classic picture, yeah. Middle-aged men and women in their third trimester or postpartum.
But it's not just them.
No, definitely not. It's really important to remember. TIO can hit anyone, any age, any gender. It's just, well, more commonly reported in those groups.
And specific risk factors. Are there any clear ones?
Surprisingly, no. Unlike, say, regular osteoporosis, where we can list things like smoking or low calcium, for TIO, there isn't a defined set of risk factors. It really underlines the idiopathic nature.
Okay, so when someone comes in with these symptoms, what else could it be? The differential diagnosis.
Good point.
Yeah.
You absolutely need to rule out other things. Obviously, standard primary or secondary osteoporosis is on the list.
Right.
But also, you're thinking about a vascular necrosis AVN, where the bone tissue actually dies due to lack of blood supply. That's more permanent than TIO.
Okay, AVN. What else?
Bone metastasis, so cancer that spread to the bone, and various inflammatory joint diseases. Got to exclude those.
Definitely need to rule out the serious stuff. How common is TIO, actually, epidemiology-wise?
It's rare. Genuinely rare. Specific numbers, especially here in the UK, are, well, they're not really well known or tracked, precisely because it is so uncommon.
So unlikely to see cases cropping up constantly.
Exactly. But when you do see it, what does it look like? Clinical presentation.
The main thing is pain, right? Sudden pain.
Sudden, yeah, often quite severe bone pain, and typically, like we said, hip, knee, or ankle.
Does it affect movement?
Oh, absolutely. It can cause significant joint stiffness, make it really hard to move the joint, limited range of motion.
Any other signs? On examination?
You might find tenderness if you press on the joint line or the bone nearby. Sometimes, maybe some localized swelling, but not always.
Okay, so suspicion is high. How do we confirm it? Investigations.
It starts, with the basics, talking to the patient, getting their history, doing a physical exam, but imaging is really crucial here.
X-rays, MRI.
Both can be useful. X-rays might initially look normal or show some osteopenia, sort of thinning of the bone. Bone scans can show increased uptake in the area. But MRI is usually the most sensitive. It can show bone marrow edema, those early changes, really well.
So MRI is key for diagnosis and blood tests.
Yeah, blood tests are important mainly to rule out those other causes. Check calcium, phosphate, inflammatory markers, make sure it's not secondary osteoporosis or an inflammatory condition.
Got it. Rule things out. So, okay, we've diagnosed TIO. How is it managed, say, in the UK?
The goals are pretty straightforward. Relieve the pain, support the bone while it recovers, and improve mobility.
So pain relief first.
Definitely. Usually starts with NSAIDs, like ibuprofen. If the pain is really severe, sometimes short-term opioids might be considered, but carefully.
And keeping things moving.
Yes, physical therapy is vital. Gentle, progressive weight-bearing exercises are actually encouraged as tolerated. Helps maintain muscle strength, joint function.
Even though it hurts.
Within limits, yes. Protecting the joint is also important, so maybe using orthotic devices, crutches, or a walking stick for a while to reduce the load.
Makes sense. What about the long-term outlook, the prognosis? You said it's self-limiting.
Yeah, generally the prognosis is really quite positive. It tends to resolve spontaneously.
How long does that usually take?
Symptoms typically improve significantly within a few months. and are usually resolved completely within maybe 6 months to a year.
That's good news. Any catches?
Well, one thing for women who've had it during pregnancy is that there's a risk it could recur in future pregnancies, something to be aware of.
Okay.
And long term, while it resolves, it's still sensible to monitor bone health, especially if there are other risk factors for fractures.
Right. And complications. Are there any Meiji ones associated with TIO itself?
Generally, no.
Yeah.
Severe complications directly from TIO are uncommon because it gets better.
But maybe fractures, if the bone is weak.
That's the main theoretical risk. If the osteoporosis is significant, or if someone, say, falls while affected, there's a potential risk of fracture. But it's not a defining feature of the condition itself.
So management helps minimize that risk.
Exactly. Monitoring, careful mobilization, pain control, it's all geared toward getting through that temporary phase safely.
Okay, let's try a quick summary for revision. TIO, transient, idiopathic, osteoporosis.
Sudden pain, weight-bearing joint hip, knee, ankle usually. Self-limiting, resolves typically within a year.
Cause. Unknown, but likely vascular or hormonal links.
Right. Risk factors. Not really specific ones, but common in middle-aged men, pregnant women, but can affect anyone.
Diagnosis. History, exam, but MRI is key to see bone marrow edema. Rule out AVN, METS, inflammation with tests.
Yep. Management, pain relief NSAIDs, physio-gentle weight-bearing, maybe walking aids.
Prognosis. Generally good. Resolves. Low risk of complications, mainly fracture potential during the episode.
You've got it. That's the high-yield summary.
Perfect. Thinking about this, it's quite fascinating how the body can have this quite dramatic, albeit temporary, bone issue and then just heal itself.
It really is. It makes you wonder about those spontaneous healing mechanisms, doesn't it? And how we can potentially harness them for other bone or joint problems.
Definitely something to think about. Okay, that wraps up our deep dive on TIO. For more support with your MSRA revision, don't forget to check out pastthemsra.com.
And also freemsra.com for more resources. Thanks for joining us.